CLARITY-PanTumor01 is a global multi-cohort phase II study evaluating Sonesitatug as a claudin 18.2 ADC with MMA payload. And this agent already showed encouraging activity in previous phase I trial in China. So this is a global study to confirm the findings. In this ASCO, we present the top-line results from Gastric cohort. The eligible patient should have claudin-positive status defined as moderate any intensity claudin expression in more than 25% or more tumor cells, and patients should receive one or more previous lines of chemotherapy. So actually, the study treatment was at second line or third line. First, we compare two doses of AZ091 or Sonebi, 2.2 mg per kg versus 1.8 mg per kg in randomized 60 patients, and 2.2 mg was selected based on safety and efficacy profile, and then additional 30 patients were enrolled in biomarker biopsy cohort. Additional 6 patients were also treated in Japanese safety cohort. So overall, 67 patients were treated by recommended dose, which is subject of this presentation. Patient characteristic in line with the usual gastric cohort. Again, majority of patients were at second or third line, half and half, and half of patients also had peritoneal metastases, and 75% of patients were from Asia. The primary endpoint response rate was 28% by investigator judgment, and the duration of response was not reached at this analysis, with more than 80% patients remained on response at 6 months. Median PFS was 4.2 months, and 40% of patients were progression-free at 6 months. And these efficacy were in line with previous Chinese data, and better than conventional historical standard of care like FTD-TPI or irinotecan. And safety profile was also comparable to that of Chinese study. 50 to 60% patients experience GI toxicity like anorexia, nausea, but most of them were with mild grade. A very small number of patients experienced grade 3 event. 30% patients experienced vomiting, but this was still less than that of previous trial of zolbetuximab. And importantly, during the trial, use of multiple antiemetics, 4 drug combination including NK1 inhibitor, corticosteroid, olanzapine, and 5-HT3 are found to be helpful to decrease GI toxicity and dose interruption or reduction. So overall, these results support this treatment AZ091 Sonebi as a promising claudin ADC agent, and we are currently waiting for readout of Phase III CLARITY-Gastric-01 trial in second and third line. Also, already Phase III trial in first line is ongoing to test Sonebi in combination with backbone chemotherapy and checkpoint inhibitor.